Asthma is chronic inflammation of your airways. For us clinicians, we actually struggle diagnosing this as much as patients struggle with defining it themselves. It really comes to the root cause down below is airway inflammation. So a patient's conducting airways become inflamed from a myriad of different potential causes. That inflammation leads to mucus production, and most importantly, airway spasm. The airways get small, making it very hard to exhale air. Now that can lead to many different symptoms: shortness of breath, chest tightness, cough, right? Even mucus production. Now, as you can imagine here, those symptoms are very non-specific. That's almost everyone in my pulmonary clinic can have those symptoms. Furthermore, in asthma, they tend to be variable. You have times where you have no symptoms at all. You have times you have very severe symptoms, and people can have all different types in between. We try and measure that airway obstruction, that airway narrowing, by looking at expiratory flow limitations. So pulmonary function testing or in-clinic peak flow measurements can give us an estimate of it. But one of the real challenges of asthma is there's no clear single test. It's not if this test is elevated, you have asthma, right? If you have this symptom, you have asthma. It really is more of a syndrome, like a collection of symptoms and phenomena that we see together to get that diagnosis. So the classic asthmatic that we think about in our head is the young child who's wheezing in front of you, right? That's the image burned in all our heads. But reality, there's other symptoms that are quite common. Chest tightness is also described very commonly amongst patients. They just feel they just can't get all the air out. Sometimes we call it air constipation, and you just can't get all your air out. You can have mucus production, right, as well, and just a generalized sense of shortness of breath. Now, there's a couple of problems with those symptoms here from the clinician perspective. One, these are very common symptoms, right? Again, these are very common things of other diseases of COPD, bronchiectasis. So it's not just clearly this is a classic asthma symptom. It's really, opens up multiple alternatives that you have to think about as a clinician. The second challenge with these symptoms here is that patients have a hard time articulating them because it's not just, my elbow hurts because I hit it against a bone. Specifically, the sensation of shortness of breath. Some people feel more anxiety associated with this, and they describe it as anxiety. Sometimes feel like I'm drowning is the term that patients say. It's very hard to really say this, and then it gets even harder when docs like me turn around and say, hey, is it better than where you were a week ago? And you're like, I don't know, right? It's fine when I'm sitting still. It's hard when I go up a flight of stairs. So there are really some challenges, and it's very common that patients have a hard time articulating what these are. I really recommend patients just honestly say your words. You don't have to worry about our script, the terms that we like. Good clinicians will be able to kind of really ask the right questions to pull this out of you, if you will. The most classic triggers that we think about are number one, infections, typically more viruses than bacterial. Number two, the big issue is environmental factors, right? Especially in Northern California, we've dealt with some very poor wildfires, which unfortunately is an increasingly challenging issue across the country and the world. But that can trigger both cause patients to have asthma from then on, but also worsen underlying asthma as well, right? Other things can trigger asthma as well, right? Allergens, again, another classic one, right? Allergens, everything from pollens to dust, right, to mold, anything kind of in our environment can really trigger asthmatic inflammation and subsequently the symptoms that we deal with. The other ones we kind of, maybe a little less common ones that we think about, cold air and exercise can trigger patients as well, right? Can kick off a very similar inflammatory pathway within your lungs and cause those very similar symptoms. Now, again, the challenge that we have with asthma is that it's not the same for everyone, right? Some people will be just fine when the wind is blowing in springtime. Other people will be knowing the exact day that the elm trees bloom, right? So really part of asthma therapy is understanding who that is for you, right? What are those triggers? Again, it's easier said than done, right? When the wind's blowing, I don't know if it's the elm, the spruce, the new flowers that grown here. Working with physicians as well and clinicians of all types, they can help you really figure out what those are through difference of testing, skin and blood testing, as well as just good history taking.